Yes, good afternoon, ladies and gentlemen. Welcome to today's webinar session. Of course, the conversation has been necessitated by the recent government initiative to have our schools reopen post-COVID. So my name is John Sodongo. I'll be the moderator for the session today. I'm the Research and Advocacy Manager here at AAK. And so welcome for the session today. To start us off, I'll invite our president to give us her opening remarks.
Right.
Welcome,
thank you so much, James. So firstly, my thanks to all the panelists who have joined us this afternoon to discuss this very pertinent topic. And of course, to all the attendees who are joining us and as we continue this session. I want to just perhaps tell you a little bit about AAK and what we have been doing around our response to COVID-19. AAK has really been tried to be at the forefront of being solution focused during this global pandemic. Earlier in the year, we formed the AAK Rapid Response Task Force, and this worked on and released a first edition document, which was titled Proposed Guidelines on Planning and Design of COVID-19, Quarantine and Treatment Centers, and Long-Term Infrastructural Interventions for the Kenyan context. So while we tackled guidelines for the health sector as a response from just being a responsible professional body and responsible professionals in the built environment, understanding, of course, our responsibility as Kenyan citizens during a global pandemic, we also recognized and began to prepare a response that would be of utmost importance to the most vulnerable of our population. And of course, that's our children. Putting this in context, COVID-19 has affected 213 countries and territories around the world. As of today, we have more than 38 million cases worldwide. We have and a number of these cases being recorded here in Kenya. We note education has been particularly hard hit by this pandemic, with about 1.53 billion learners who are out of school globally and 184 countrywide school closures. This impacted globally 87.6% of the world's total enrolled learners. Dropout rates, of course, are likely to rise as a result of this massive disruption to education access. So of course, while other critical needs such as health, water, and sanitation are being responded to, educational needs cannot be forgotten, and it's now been pushed to the forefront. And these have an equally detrimental impact if we do not address it. A pile-on effect of what COVID-19 will do to the education situation. And certainly, of course, even long-term implications, especially for those who are most vulnerable of us. So what does this mean for all of us? The primary focus for educators, for parents, for anybody who is thinking about children going back to school is to keep the children safe and to focus on prevention of transmission. So that will be the conversation around today's discussion. So with this in mind, AAK formed the AAK Safe Learning Task Force, and you'll be hearing from some of the members of that task force today. It's been over 6 months since schools closed, and this impact has continued. The tempo has never been more uncertain as to how we reopen schools safely. It's one of the toughest and the most sensitive decisions on any political agenda in any country in the world. And then also looking at, as we continue to keep schools closed or as we continue to reopen them under a pandemic, what are the consequences to children's mental health and also to the social development of young children. According to the Kenya Economic Survey 2020, Kenya has 10 million learners in primary schools, over 3 million in secondary schools. The average population per school is about 311 for both primary and secondary schools. This works out to a class size of 39 and 78 for primary and secondary schools respectively. We have about 258,000 classrooms in primary and 42,000 classrooms in secondary school respectively. To safely reopen for class sizes of 20 learners per class, it means that we basically need to build and commission about 245,000 new classrooms. I just really want us to put that into context. 245,000 new classrooms. That is for primary, and 122 new classrooms for secondary schools. If we just base this off, our regular cost estimates, that's about 400 billion shillings to build and equip additional learning spaces to accommodate just 20 learners per classroom. So it's an enormous task for us as built environment professionals. It's an enormous task for school owners, business owners. And it is in the backdrop of this that as an association, we found it very prudent to do a supplementary publication or as a task force on design strategies for safer schools post-COVID-19. It's a response to ensure we will build back better and we ensure every child returning to school will be safe to learn. This task force is completing its first edition of the proposed strategies, and we'll discuss this a little bit. And within this backdrop, we are hosting this webinar to discuss some of those findings and recommendations, and also to hear from other stakeholders, including school owners, the healthcare sector, so that we can really start off at an informed position. So with that, members, panelists, again, asante sana for being part of this. I want to welcome you to this session and really encourage a very, very vibrant discussion on this very, very important topic. So karibuni, and back over to you, James.
Thank you very much, Madam President. We appreciate the whole essence of setting the conversation for us. So we'll start off by introducing our panelists. And for that matter, I'll start with Mr. James Ngunjiri. He's a qualified accountant, a company secretary, and a financial analyst with an MBA in information systems. He has over 10 years experience in risk management, as well as extensive experience in healthcare strategy and financing. Of course, one of the biggest risks to the education sector as far as COVID-19 is concerned is the whole idea of face-to-face learning. And so he'll be offering us insights into some of the issues that the education sector needs to adopt to manage the risks. Thank you, and welcome, Mr. James Nguziri.
Thank you, James.
Okay. Our next panelist is Mr. Nixon Otieno. He's an environmental designer and secretary of the AAK DC chapter. He has a lot of knowledge as far as the education sector is concerned in relation to infrastructure provision and related utilities. He's a UNESCO recognized education for sustainable development expert and a UNEP recognized environmental education expert. Of course, he's also engaged in different projects as far as education facilities are concerned as an architect, and has also consulted for WHO and MOH on air pollution. Welcome, Mr. Otieno.
Thank you very much, James.
So our next panelist is Eta. Eta Madete is an architectural designer at BuildX Studio. She's also a tutorial fellow at the University of Nairobi. She, of course, has engaged in a number of projects, the most recent one being the McKinney School. She has a lot of experiences within the tenets of teaching and research as far as architectural design innovation is concerned. Most recently, she was the Kenyan lead researcher for the 2020 Guggenheim New York exhibition with Rem Koolhaas, OMA, and the Harvard GSD. So she was also part of the AAK COVID-19 school reopening task force. Welcome, Eta.
Thank you, Jane.
Okay. The next panelist is Dom Cox. He's a BIM expert. He was also part of the team that was there, the COVID-19 task force response team, as far as healthcare management was concerned. He has also played a critical role within the school reopening task force, and he'll also be giving us insights on the whole essence of, the whole component of sustainability and future-proofing of schools beyond just the COVID-19 pandemic. So last but not least is our immediate past president. She really has a lot of credit to herself, but within this context, we'll introduce her as an architect at Design Source Limited. She's also an educationalist and a director of Kyoto School. Welcome, Madam Immediate Past President.
Thank you very much.
Okay, maybe just to set us off, I'll invite you to assuming the role of the educationalist, give us insights on maybe the activities that your school has taken up to ensure that there is some sort of seamless reopening of schools, while ensuring that students are safe from any sorts of infection.
Thank you, James. It's wonderful to see everybody today, and to have so many people on this platform just goes, on this webinar just goes to show how important this issue is. The word you use is seamless. That's a very tricky word to use in these times of COVID. I don't think there's anything like seamless anymore. And I think our president did allude to that especially with education, and that's why it's the last one that to reopen in our country. It's a very sensitive issue because of our children, and children evoke different types of emotions in people. And it was interesting. I think there was a joke doing the rounds of how everybody is excited that the bars are reopening, but schools, wait a minute. Guys had a few questions, and it was an interesting perspective to see how the reactions are different, because it is sensitive. Our children are, they're a future of our humanity, as it were. So we do tend to want to ensure that they are safe, and even as parents, even as educationists, and that's a priority, I think, not only for our school, but any school, in terms of the health and wellness and safety of our school community. So that's one thing that we've prioritized, and I don't know whether we can, I can throw a question to the audience just to already gauge, if the chat is open. Are you comfortable with, if you're a parent or an educationist, are you comfortable with the children coming back to school? And I'd just love to, involve you and see. So as I said, so yes and no on the chat would be great, yeah? But so just looking at priorities, and there are many aspects to wellness and health. First is the physical, which everybody's pretty familiar with by now in terms of COVID interventions. There's ensuring that it's face safety first, so social distancing in the classrooms, 1 meter minimum, 1.5 minimum apart, ensuring you have your temperature checks, you're logging those continuously throughout the day, not only morning, you're continuously monitoring learners, staff members, and any visitors who are coming to site. There's hand washing, which is, one of the biggest defenses. So just making that a bigger deal. Anytime someone's coming into the premises, ensuring they're washing their hands, and also building a culture throughout the day of children washing their hands after lessons, washing their hands before eating meals, washing their hands after going to the washroom, and making it routine. The people are always washing their hands, not when they feel like, but as, just the way they would, switch lessons and a bell goes off, you have to wash your hands. So just in terms of physical, those are important one. Another one is in terms of transport, also very tricky, but ensuring that in the vans, in the school vans, that also the social distance are observed. So, and ensuring that they're dedicated seats to children. So children sit in certain seats all the time. So I know my spot, and every morning or every evening, I'm sitting in the same spot. That's the physical, which might even be a little bit simpler. We've got social emotional, which I find very tricky. We've gone through, if not one of the hardest times, if not the hardest times of our lifetimes, both for ourselves and even our children. So just coming back to school and assuming it's going to be business as usual would be wrong, and assuming nothing happened. There is some level of recovery that is required. So as a school, we're thinking about that in terms of mental well-being of the children. They do need to reacclimatize themselves to this sort of this is a new way of they've gotten used to online learning in our case. May not be the case for other children, but just coming back to this space after a very, some level of turmoil worldwide. So how do you reintegrate the children? How do you, it will need some time just to socially and emotionally ensure they're back to mentally to being able to learn again, and giving them a sort of soft landing. Even for the teachers, there's a lot that teachers have gone through since March, a lot of readapting and coming back to that and sort of finding our balance. And in that finding your balance, it'll call for a lot of care in terms of mental health, well-being. There's behavioral changes that we'll need to institute. Again, I've talked about the hand washing becoming a habit that you do all the time. A bit difficult in terms of behavioral changes because we are social beings as humans. And for us, we've just been struggling of, 6-year-olds, 5-year-olds coming back to school, and you're used to how you connect, how kindergarten teachers connect with their children is through hugs and touch. And yet now we're being told the one thing that they crave for, they cannot do. So what does that look like? And it's been, you may have been in a few social interactions and you know the awkwardness of it. You want to hug someone, you don't know whether to hug them, they're masked. So that's almost a shifting of what is very natural to us as humans and sort of instituting something that is unnatural and more difficult for the younger learners to do that. So that will take some behavior change. And then also in terms of cleaning of the schools, there's more, there'll certainly need to be a lot more attention paid to cleaning of services, fumigation, and the frequency of that. So that's again on the physical realm. Then of course there's in regard to response, when an issue does come up, if there is a case, that's going to be something really to grapple with. We may try to plan it out, but what happens when a case is discovered in terms of isolation? And it's great to see that there are doctors here. We're almost lucky because it's a day school, but imagine the boarding school scenario. How do you isolate? How do you map out the people that this person has been in contact with, which is the nearest health center? Or how do you deal with that? And about the stigma as well that may come out of that, stigma for the person, stigma for the people who are interacting with that person, and stigma for the school. So that's also something that we'll grapple with. Last but not least, and I know a few people will be talking about it here, is future-proofing our education system. So we cannot imagine that education will go back to what it was in March. We have used technology a lot. It came to the rescue. We also came to the realization that there's still a place for face-to-face learning, especially with the younger learners, that it cannot be technology all the way. But they have been exposed sort of to this drug, because technology sometimes is like a drug, they're used to computers now. What does the future now look like in terms of education? It cannot be back to pen and pencil only. So what does that blended learning look like? What does it look like for children who may have to isolate, but because someone in their household, for example, is sick, but they don't want to miss out on learning? So technology is here to stay. How do we find a balance between all that? So I think that's just in a nutshell. I know I've taken a bit long, but that's just in a nutshell what we're going to be grappling with moving forward. The one I feel more for is in terms of the social emotional and more of the soft things and how to grapple with that. Because social distancing and hand washing points may be even the easier one. Thank you. Thank you. Over to you, James and Asante.
Okay, thank you very much, Madam Emma. So maybe, of course, in your context setting and identifying the scalable solutions, one key element that was coming out was the whole dynamics of ensuring the safety of the students from a health perspective. So to help us with that, I'll invite Mr. James Ngujiri to give us an overview or highlight to us some of the proposals that they've, of course, he's also gone around various schools in the country, seeing their preparedness. So he's compiled some information on the respective health measures that schools can take to reopen. So over to you, Mr. Ngunjiri.
Okay, thank you, James. And I'm James Ngunjiri, the Managing Director of Healthcare Consulting. And probably one of the biggest client or consumer of the designs that are likely to come out of the architects of this country. But having said that, I think what we need to look at is where we are coming from. And looking at where we are coming from, I think we seem to have probably not been ready for the COVID situation, not because of a lack of planning or a lack of foresight, but primarily because of a lack of implementation. And the reason as to I make this claim is because in 2009, the Ministry of Health then and Sanitation, together with the Ministry of Education, had an interministerial program. And in this program, they had come up with a policy for the national school health policy. And looking at what needed to have been done in 2009, this is what we are trying to struggle with now after COVID came knocking. And so basically, in my visits to the number of schools, I can say, yes, there is, especially in the public environment, there's a lot of things that needs to be done, which ought to have been done much earlier, but maybe which we just did ignore. And I think that the issue of COVID, what it's done is that it's just brought the same matters to the fore and said, okay, fine, new people. I think it is time to also reconsider these issues and consider them very aggressively. I heard what the immediate Madam President has just talked about, the immediate past Madam President, and the question that she asked us, whether we are comfortable. And as a parent, I think I'm comfortable in taking back my child to school because this is a flu. As much as, yes, it has its own challenges in the sense that we've not understood it to the full. The fact is that if well managed and looked after, then it is possible for us to continue learning. You notice that we are talking about 184 countries having had nationwide closure of their schools. And I'm certainly sure that even the other countries whereby there has not been nationwide closure of schools, schools have been going on, and I'm not sure that all the kids in those other countries have died. I believe they have still existed, and there is reason as to why we should be a bit more positive in the fight and try not so much be too scared, but try and do what we said in 2009, or the policy guideline that had been given by both Ministry of Education and Ministry of Health in 2009, that we are going to implement the programs. And maybe one of the critical things that I would want to pick out in the health school health policy is that we were to provide, or the Ministry of Education, together with the community surrounding a specific school, they were supposed to provide adequate and accessible infrastructure that conformed to the requirements of the health standards. And that was in 2009. And it had been defined to be either a dispensary, a sick bay, or a sanitary. And when I hear what the Madam President said, that yes, we may have a bit of a challenge in the event that there is an issue in the school. When the schools reported yesterday, I would like to mention that in one of the schools where we are involved in the management of their health, we had an incident in the night. But the incidents happened, and because we had qualified personnel within the school, then it was easy to handle the matter. Because not everything that turns out to have that is as a result of maybe high temperatures or things like that is COVID. It could be something completely different and something that is can be treated. Well managed, I would like to say, yes, it's possible to have these things done. We are way behind because we are trying to race against time in terms of what needs to be done, but we would have been more prepared if we had just rolled up our sleeves and done what we had said in 2009 that we were going to do. And what are those? In the case of the management of the school health facility, we're looking at a facility that could be able to do all that needs to be done in an outpatient case. That is the triage, the consultation, observation, and the procedure rooms, and then also provision of the medication. Because here we need to remember that is the provision of the service that is required, more than just the provision of the infrastructure. Then there is also going to be a lab that can be able to help us determine what exactly it is the situation on the of this particular patient, so that not every patient is considered to be only suffering with that one issue of COVID-19. And of course, a place whereby these people can do a bit of some cleaning, that is the sluice in terms of of provision for a dispensary or a sanatorium. Then coming specific to the COVID environment, in the COVID environment, one of the things that we need to do is to isolate. And so what I've seen in most of the schools is that we've got a big challenge in terms of the physical infrastructure itself. And we don't seem to have any isolation rooms, because this is not something that we ever thought that was going to come to us. And so in an isolation center, what do you expect, or in an isolation environment whereby we have the students, we'll be expecting them to have at least a few beds where they can physically be able to isolate. And here we're looking at these beds are within a room, or they can be social distance within two meters, or maybe you could even be having a physical wall that separates between one person to the other person. Of course, these people would have their own ablution area where they will be able to attend to their needs. And because they cannot be left alone, then there has to be a person monitoring them, so a health attendant. Whoever the health attendant is will probably be within the same location, within easy reach and everything else, because it's a 24-hour operation that we're talking about. And this attendant should be created for a sort of a facility where they can be able to just be able to dose the whatever the PPEs are and all those kind of things. And of course, in this area, also provide them with the other the WC facilities that they would be needing at that point in time. So James, maybe I stop there so that we can bring in the others. But the government guidelines, maybe those ones we can quickly go over them as we continue with the conversations.
Okay, thank you. So maybe just, you've mentioned the bit of policy guidelines and lacks in terms of implementation of the same.
Yes.
Our EDC chapter on secretary was in charge of a team that was looking at the legal framework. So I'll just call him on board. Mr. Nixon, do you believe there's a lack of implementation in terms of the policy guidelines and securing of school infrastructure to accommodate students as far as school reopening is concerned? Or is it a case of there needing to be more legal, some sort of a legal review to allow for implementation of the same?
Thank you very much, James, for the question. And I would build on what James has just raised. And I would concur. From our subgroup's work, we reviewed quite a number of policies, existing regulations and policy frameworks within the health education sector. And our general concurrence is that in terms of policy frameworks, we are not really lacking. In fact, the best manifestation is the most recent guidelines that was issued for the opening of the basic educational institutions. You realize that it's pretty robust in terms of proposals. A little bit, of course, theoretical in terms of bearing in mind the realities of the learning institutions we have in the country. So I would refer you back again to about 12 years ago, when Agujiri has mentioned the health, National School Health Policy, but also the ministry, together with other partners, including safe zones, produced a manual that has been largely used in the country called Safety Standards Manual for Schools in Kenya. Now, if you review all these documents, you realize that we have very good provisions for preparing our schools for any emergencies such as the COVID-19 situations. even to be resilient for disasters like flooding or fire. But in terms of implementation, we are seriously lagging behind. And I think, as has been mentioned by the President, Madam President, around some of the challenges could be on the finances. But from our finding, we found the major issue that we could, as professionals in the built environment, intervene include strengthening the institutional framework to support the school managers to be able to actually implement some of those provisions in those regulations. I give you a case which is happening at the moment. I would largely talk from the public sector. The past former president has just made a reference from a real case as a manager of a private school. But you find that most of the schools, how they are managed as provided for by the Basic Education Act, number 14 of 2013, we basically have the principals, a lot of the responsibilities left to the principals. As much as the regulations, the safety manual provided for formation of health and safety committees in schools, if you do a quick survey of the schools, you find that those committees are really largely non-existent. So the responsibility, the buck again stops with the principal or the deputy that is assisting him. Now, when you come to the boards of management, if you look at the same act, who qualify for the representation in the boards of management? Of course, there's a little provision for interest groups, but largely you find that these interest groups would be either occupied by the school sponsors, which are churches, or you have the immediate community representations. You don't really have space for the professionals that contribute significantly to shaping the school infrastructure. And here I'm talking about the built environment professionals to be represented. So you have boards that they are experts in their field, the representatives are experts in their fields, but they don't have the really technical knowledge and expertise to be able to support the school in terms of planning for the infrastructure and making it responsive to be able to meet the adequate needs of the school as provided for in the regulations that are already in place. And that comes from the school level to the sub-county level of education that you come to the county education level. So what we are recommending as a task force is that we don't need an overhaul of the policy. We are really saying that the policy framework that we have is largely sufficient. We only need a little bit of tweaking to be driven towards enforcement and implementation. And we are lending our hands as the built environmental professionals to be available. We are presenting ourselves to be available to be part and parcel of delivery of these regulations. So one of the strong recommendations we are making within the institutional framework for the management of the schools in the country is that the boards that are responsible for managing the schools need to be expanded to incorporate technical representatives from appointing professional bodies like Architectural Association of Kenya, Institution of Engineers, so that they can sit, of course, first of all, at the sub-county or the county education committees. We are also recommending that there needs to be a technical advisory committee at the national level that can actually advise the government on the practical technical issues to be able to comply with the regulations they've made. And lastly, we are also observing that even though our health regulations are very clear, for example, the OSHA Act is very clear on looking at the work environments as places that need to put in place measures for safety. Our learning institutions have largely been categorized not as workplaces. So we only look at learning institutions from a perspective of a place where students come to learn. But while they're learning, we actually do a lot of work. We have teaching and non-teaching staff. So we are strongly recommending also that it is high time that these policy frameworks be strengthened to also look at the learning institutions as both learning environment, but also as work environment. But largely the most important thing we are saying would be we need to get back to inclusivity. We need to have technical people support the managers of the school in managing the schools. This scenario of where you have the Ministry of Education, I give you a very realistic case. Recently, we had the task force for school reopening. We didn't have any representation from any professional body, whether you say it is AAK or Institution of Engineers of Kenya or IQSK. There was largely no representation, but we are talking about these huge environments that need to be readjusted. We need to look at their adequacy and come up with proposals of how we can effectively and radically make adjustment to be able to accommodate the reopening. But then you're not involving the stakeholders that are involved, who are technically competent to shape those environments. And we really saying strongly from this work that the AAK is doing through developing this guideline, that we need to engage the professionals within the built environment at different levels, from the national policy making level to the county level, even to the level of the school administration, because we have so many professionals in the country that can actually be able to sit in almost every other school. And there's really no excuse for excluding them, yet we expect our learning environments to be really sufficient to comply with the existing regulations and the policy frameworks that we have in place. James, I would leave it at that point for now. Thank you.
Okay, thank you very much. So inclusion of professionals it is. And maybe now I'll bring on board Eta, who has been involved in design of and implementation of different projects for schools. And in your Eta, maybe just in a nutshell, do you believe professionals are not involved in the design of schools and implementation of related infrastructure? And while at it, recently professionals have been sort of criticized for adopting weird or just traditional designs as far as classroom redesign is concerned. Recently, the Ministry of Works sent out an invitation for construction of new classrooms. As it is, people are criticizing the same because whatever was there in the 1970s is what has been replicated to present day. So would you just give us your opinion on the same?
Thank you, James. And yes, I think I agree with our previous panelists and presenters that in the reality is that when we come to mass school designs, it becomes very difficult to implement things that are a little bit, too exclusive and too particular. But the reality is that the education sector is shifting entirely. And in the schools that we've been working on in the last 1 or 2 years, the sort of mandate is that even the public school system is shifting its pedagogy. So we are going to the CBC curriculum, which means that if you analyze the kind of curriculum it actually is shifting to, the spatial requirements are not the same. The teacher needs a lot more space to learn. The students need a lot more space to learn these particular skills. And the teacher also requires more space to be able to do the one-on-one teaching and to enable a better teacher to student ratio. And so even the CBC and the changing curriculum had demanded a change in the way that we design spaces. Beyond that, the new curriculums globally as well are encouraging a lot more indoor-outdoor interactions. So learning is not just in the classroom with the four walls. And as COVID came and hit us, that the reality is that these also collide. Is that we need more space to accommodate social distancing. We need to embrace a lot more outdoor-indoor interactions. And even as a lecturer at the University of Nairobi, we are realizing that there are two key problems when it comes to education. I think Emma put it really wonderfully and said, how come we don't have a problem with bars? In fact, we cried for it. But the thing is, just like bars and supermarkets and shops, they can actually say we have enough people, wait, or make a queue. I think sometimes when I was queuing here in Westlands to enter the Naivas, if the supermarket is full, I need to wait outside. But on the other side, learning is very inclusive. How do we make sure that we're not keeping people out? How do we make sure that everyone is learning at the same pace with the same kind of opportunity and access to the space? And for that, as our president shared, the numbers are overwhelming. Having to create 245,000 new classrooms to accommodate the right kind of social distancing is just not feasible at the scales that we're thinking of right now, especially as James mentioned, the fact that things that we had said we were going to implement 10 years ago have still not yet been implemented. So right now, COVID is almost like a wake-up call, first to embrace the kind of spatial qualities that the CBC curriculum is asking for. Can we really use our pedagogy to change the way that we teach, embracing more indoor-outdoor interactions, using the spaces that we have now in more creative ways so that we can actually teach students the different modes of learning, the sports, the culture, the arts, also enabling the teachers to also practice different ways of having more one-on-one interactions, whether it means splitting it up or creating different spaces that can embrace the new pedagogy that's shifting, but also embrace COVID and social distancing. And the task force team 2, which I was working and working with Alim and Dom as well, we were looking particularly at retrofitting. So our mandate at that particular as that particular group was to look at what can schools do now to adjust or to plan on adjusting. And there are 3 things which we have developed, and I'll share my screen now just to share the 3 things as quickly as possible. The first is a tool that the head teachers can use. So we realized that the reality is that imagine you're a head teacher in a school. This is a school you have, and even before you know it, the children are coming to the school. So this flowchart that Dom worked on is basically looking at how can we create a big poster that we give to the school where the head teacher can come and say, here, this is my classroom size. That means that, what is my classroom size? You can fill it in here. What are the students for every single room? And then from here, they'll give you the requirements you need for that particular classroom. We can also come and the head teacher can be like, this is the desk spaces here, and this is how much space I require or how many desks I need to create the right kind of social distancing. And so this is a tool that the head teachers can use as almost like a checklist tool. Again, as architects and professionals, we also create a sort of wall where we give very complicated things that nobody can understand. So in this task force, we're looking at how can the schools actually be able to retrofit and tools that they can use. The second we were looking at are the architectural qualities that are possible in the school. And as shown in the sketches here, you have, for example, the existing, so let me go here. So this is an existing typology. That's the normal 3 classrooms in a block. Can it be retrofitted, for example, if you wanted to have the right social distancing by demolishing the internal wall so that the students can still see, or alternatively having a board, an internal classroom and an external classroom if the weather allows, and the possibilities that can happen in a typical school to create that space. Furthermore, how can we deal with the entrances and exit circulation? So how can they retrofit the existing circulation systems to enable better social distancing and also control of sanitation systems, like having 2 or separate exits, as well as the dining areas, for example. Now that we can not all fit inside the dining, can they use the landscaping steps or create additional external spaces for retrofitting? And so that's another tool that we are developing in terms of controlling the space. How do you zone double bunk beds in the boarding area? How do you create sanitation in the bathroom and bathroom facilities as well? And the last thing we were looking at, and this was done by our team captain Alim, is looking at using technology to better enable schools to send information to the government on what they actually need. So they can be able to fill in this app. Wherever they are, they can put in their name, their school name, their county, and then from there, they can count how many classrooms they actually have and quickly work out what areas they are and how many students they're expected to have. And then from there, the app would be able to tell them, based on the calculations that have been created, how many additional square meters or how many additional spaces they may need. And again, this is not necessarily for the head teacher to take on. It is so that, for example, we can send that information to the government and see how many modules of classrooms does this particular class needs. And that way it creates a sort of feedback loop to enable the head teachers to be a little bit more empowered in this situation. And as I said, the 2 main problems you're having when it comes to the education and learning spaces, and I experience it as well when we're looking at how we're going to reopen the universities, is the numbers and making sure that everyone has access to this learning and this teaching. So I think I'll stop there. I hope I answered your question.
Okay, thank you very much. Just to mention it, of course, we've taken up the proposal for the application. Of course, this would be a useful tool. One of the challenges that maybe Eta never mentioned was that the task force had a challenge of getting data on existing infrastructure for schools. So we believe that the app would be a critical tool for audit and documentation of existing infrastructure. So we've talked about the need to retrofit existing infrastructure and the whole element of innovative designs. But now retrofitting might be a temporary solution. Maybe for Dom, what do you look in terms of sustainability beyond just the COVID-19 pandemic and future-proofing of the school infrastructure against such pandemics maybe in future? Do you think Kenya has the capacity, and maybe what are the proposals you float for schools beyond just the COVID-19 pandemic?
Okay, thank you, James, and thank you, Etta. The Team 2 does overlap somewhat with the Team 3 work, but the Team 3 brief was sustainability and long-term interventions to future-proof learning environments. Team 3 comprised of volunteers, which I was a captain. I'm a BIM design coordinator, and we had Agre Maganga from Studio Forte, Nakoya Mazibali from Builders Pith, a consultancy and arbitration service. We have Kevin Andeti, an electrical engineer from Ferrodin Associates. We have Terry Odula from Shelter Solutions, an architect in Nairobi. We have Kennedy Samoka, principal at SPAN Architects, and we have Ascendi Sylvia, lecturer at the Technical University of Kenya and a National Construction Authority manager. So future-proofing, firstly, Team 3 agreed that a low target cost rate in the range of $150 a square meter, so that new building is reliant on locally sourced materials. Regarding future-proofing for the 21st century, someone famously said that entails education, education, education. And so schools and learning environments are axiomatic to those ends, particularly climate change and consumer economies. And for example, the obesity crisis in affluent societies such as America and the UK is a major factor in COVID survival rates. So education is, if you like, the future-proofing per se. So within that pre-COVID future-proofing frameworks, and documents and reference documents include the following. So we have Managing Risks for a Safer Built Environment in Kenya, published by the World Bank in January 2019, which includes seismic and epidemic events. We had the Education Disaster Management Policy of July 2017, which also includes epidemic and seismic events. We have the Primary Education Development Project, the Environmental and Social Management Framework, the ESMF, published by the Ministry of Education, Science and Technology in 2015, and that addresses, and I quote, the persisting inequality in education outcomes, and it adduces that, I quote, while the growth of the private sector has helped reduce the strain on public resources, it also poses the risk of increasing socio-economic stratification between schools. We have also the Southern and Eastern African Consortium for Monitoring Education Quality, SACMEC, currently in Tranche 4, and that was published in 2019, and it highlights reading, which puts the library at the center of the school plan, but also the nurse station and the sick bay, and it recognizes that there's been very poor performance in implementing the sick bay in the school, as it's a requirement of the World Bank funding, and essentially SACMEC is a tick box for World Bank funded projects. So future-proofing also means enforcement of the Kenya Building Code, as Nixon and well, many of the panelists have already pointed out. The implementation is the weakness. And for example, the National Construction Authority reported last July that of the 36 sites it inspected in one day in Nairobi, it closed 20 of them for non-compliance and made 5 arrests. Future-proofing also means curriculum reform and modernization. And for example, the Form 3 current set books in English and Swahili intend an introspective equality agenda, the inclusivity which Nixon talked about. Furthermore, future-proofing means BIM, Building Information Modeling, for the physical and spatial audit of the education estate country-wide, as Etta has just mentioned. And in fact, the mechanism for that uses technology, and Aleem has developed an app idea that the head teacher can simply plug in the data to an app, and it immediately does a spatial survey of the school, of a room and a combination of rooms. So School design examples of future-proofing. Firstly, in the past, almost 100 years ago, in the aftermath of the Spanish flu pandemic, future-proofing schools in Kenya resembled an expression of palatial, neo-Tuscan grandeur rather than the Bauhaus machine age optimism. And that is epitomized by Herbert Baker's Nairobi School. It's modeled on the Winchester School in the UK, which was Lord Delamere's alma mater, and it's a cloistered courtyard college established in 1382, 650 years ago, by Bishop Wickham. And it was intended to supply New College, Oxford, with scholars drawn only from low-income families. 5 years later, 1933, following an earthquake in Los Angeles, Richard Neutra designed his Corona School, a lightweight, modern, fast-track range of classrooms in a simple layout with ample volumes, daylight, cross-ventilation, and outdoor teaching spaces, drawing from the Hispanic tradition of courtyard layouts suited to the hot climate. So that was future-proofing 100 years ago, and that's what that looked like, two very different interpretations. So now in Kenya, Team 3 members highlighted more modern school precedents, and we can see those. There are 4 which attracted our attention: the Ika Moyo at Ezamoyo Kilifi, which by the students of the Oslo School of Architecture; the Makini School Nairobi by Buildex, which Ethel Madete was project architect; the water banks at Laikipia by Pitch Africa's architect, Professor David Turnbull in New York, and delivered by Agri Maganga, one of our team members, Studio Forte, and funded by the Jochen Zeitz Foundation. The Why Not Academy in Nairobi by Italian architect Gaetano Berni with architect Ascendi Silvia, also one of our team members. So that's what new future-proof schools look like. They're built, they're here, they're real. You can go and see them. We also have the Secondary Education Quality Improvements Project program, the SEQIP program, a substantial $200 million World Bank fund, currently progressing with AAK members Dama Services, Heritage Associates, Odyssey International, under the aegis of the Ministry of Education's architect Sylvester Mully. So that was the background before COVID happened. So on the 15th of September, the Ministry of Education published its stipulations. And yes, roughly speaking, we've got 12 million pupils, 8 million in primary and 4 million in secondary, or thereabouts. So we'll just go through all of the crucial points that document requires. Firstly, distancing. At 1 meter distance, you can just about get 36 children in a classroom with a pupil square meter ratio of 1.5 meters squared per pupil. But the head teacher has discretion, because not only might the World Health Organization advice change, but also the global supply of masks might be disrupted. So it might be necessary to increase the distancing and reduce the ratio to 1 to 20, which has already been mentioned. Outdoor teaching, of course, but it must be capable of resisting rainfall, because you can't put the children back into the building without disturbing the distancing. Of course, hand washing, sanitation has been mentioned. Hands-free contacts, I mean door hardware, handles that you don't touch with your hand. Those are already marketed on the internet, and that's one of the things that Group 3 addressed. Entrances and circulatory regime, the one-way system, which was familiar to the healthcare setting, may well be applicable in the school for infection control. Signage for COVID, signage, washing hands and so forth. Dust filters, because dust is detrimental to respiratory resilience. Together with ventilation enhancements. And the typical Kenyan vernacular school room has a truss with no high-level openings in the roof. So we looked at that, together with acoustic insulation for roofs, because teachers can't teach when it's raining because of the noise on the mabati roof. And that means precious teaching time shouldn't be lost to that. Water supply. Rainwater harvesting, that's simply fixing gutters to these roofs and building tanks. We found that brick is cheaper than plastic by a long way. So brick tanks and gutters is an imperative of the ministry's stipulations, together with washrooms with running water, it says, and that means header tanks, plumbing, and particularly a washroom facility for persons with disability. The nurse station, sick bay and isolation room is a requirement, which we've mentioned. Kitchen adaptations, dining and food storage adaptations, and utensil sanitation is a requirement. Community facility cooperation, which means it's mentioned in the document, and it means that community spaces that are underused or not used should be made available to schools for additional teaching space. E-learning and information technology. The advantage of this might have in widescreen video projections is to keep a high teacher-pupil ratio while distancing. And we've developed that in something called the stadium concept. Basically, it's a big amphitheater with a big projection screen, and you can then one teacher can still teach up to 50 or 60 students. Games and recreation restrictions are stipulated, and we've looked at one of the architects, Sylvia, particularly interested in new forms of recreation, and she came up with the idea of a life-size chessboard. Staff room adaptations for distancing, stores are mentioned, and face mask dispensary, together with waste management protocols, including incinerators and pedal bins, because much of the COVID waste is treated as clinical waste and has to be burned. School transport is, of course, mentioned, slightly rather beyond our remit, but borders, dormitory distancing in severely overcrowded dormitories is something that ETA has already, and in fact Nixon also mentioned as a critical factor. One of our team actually thinks that boarding schools should not open because they're incubators of contagion. So over those past few weeks, Team 3 produced design solutions for these imperatives, which will be published shortly by the AAK task force. Turning to sustainability. The expression sustainable development is, in its original Old French, implies propping something up from below, to soutenir. In its broadest sense and its dictionary definition is economic development that is conducted without depletion of natural resources, which is in practice a contradiction in terms. The phrase references the two ancient Greek words ecology and economy, which share the same root, the echo or home in Greek translation, and that means for us, planet Earth. So as a climatologist, an eminent climatologist, Bruno Latour, officially confirmed that planet Earth has now entered the age of the Anthropocene. This is the geological period in which human activity has become the dominant influence on climate and the environment. He also points out the estimation that for the entire world to reach the level of development which the USA enjoys, we would need 5 more planet Earths. However, Bruno Latour is also a theologian and is very fond of quoting Matthew verse 16, chapter 16, verse 26. What good will it be for someone to gain the whole world, yet forfeit their soul? And he is also fond of reminding us that the word human derives from humus, which means the soil. So, prominent in our team, Sandy Sylvia advocates forestry as the undeniable and excellent agro-business which provides sustainable solar-powered construction material. And by planting billions of trees, it not only has the added virtue of sucking up the excess carbon dioxide by photosynthesis, but also provides a cash crop for the small-scale farmer, which can yield better returns. So in the confusion, complexity, and contradiction of 21st century climate change, there is an architect I think is absolutely brilliant. It's Burkina Faso's architect, Diabedo Francis Kerry. I believe he's a leading light of clarity, balance, and optimism, notably in his own school projects, Gando and Dano, and one other in Burkina Faso. So that concludes my overview, James, and thank you for your time attendees and panelists.
Okay, thank you for that. Maybe I'll just rope in the former president again. Listening to the proposals, and of course, being a director of a school, has this impacted, has the COVID-19 pandemic impacted on your future plans? Say, if you had a strategic plan, does this impact on how you'll be designing school classrooms and infrastructure within the facility from now henceforth?
Thank you, and thanks to all the panelists who've spoken very, very well, and all the teams that have presented their interventions. Very, very useful. Winston Churchill says we shape our buildings and then our buildings shape us. In the same way, in terms of education, architects have such a big impact on how students learn, and physical space has such a big impact on how students learn, and now much more on their health as well. So certainly, Etta did say that this is a wake-up call. It's a wake-up call for private sector. It's a wake-up call for public sector. And we should not let this lesson that COVID is teaching us pass. It's a watershed moment. It should impact not only in education, but architects across, whether it is planners in terms of city design, whether it's architects in any building we do. How we work, how we learn, how we live is going to fundamentally change. And yes, to answer your question, COVID will have not only an impact on how we plan for physical spaces, but even economically, I think for everybody, in terms of rethinking any plans we had previously, it would be such a waste if something like this has happened and we have not drawn any lessons from it. So yes, and the challenge is to not only private sector, educationists, but public sector. This is a moment to fix a lot of things that has been presented by the universe, and we must embrace it, not for ourselves, but for our children and our children's children. Thank you.
Okay, thank you very much for that. Maybe just a reminder to our participants, we are going on with the conversation online at AAK webinar. At AAK KE on our handles on Twitter and Facebook. The hashtag is AAK webinar, hashtag school reopening.
James,
yes, please.
I'm just curious to see what the results of the poll is. I saw you did an impromptu poll. It looked like 90% were not comfortable with school reopening, which is very interesting. Yeah, okay, at least that's 59% not comfortable.
Yes.
Thank you.
Yes. Okay. Before we take in the questions, of course, participants will be engaging on the Q&A platform. So maybe Mr. Ngunjiri, the former president has mentioned that there's the element of behavioral change just to adapt to the whole COVID situation. But we also have the challenge of schools, say in Baringo and the rest, who may not have the necessary facilities as far as health requirements are concerned. There are proposals that your team has come up with that may help in such scenarios.
Thank you, James. Yes, within ourselves, what we are trying to do is come up with something that we believe that every Kenyan should be able to afford. In the sense that even when you look at the public institutions where we've spent quite a bit of time in there and trying to come up with a sort of a sick bay that would be able to attend to all the needs of the patients or students, in this case, in terms of their health. The whole concept about how it is priced and how it is going to be funded for purposes of ensuring that everybody gets to get a quality health within the school environment, that has been very, very key and very fundamental. And what we did in some of the schools, we've engaged the parents. The parents have had their conversations as well, because you realize also still in the national policy, if I go back to it, the community was supposed to also be involved in the mobilization of the resources. And in this case, it's not just the resources to build the infrastructure, but it's also the resources to help in terms of making sure that the service is available. So to answer your question, yes, we're looking at that as a possibility, and whatever issues that they are in terms of the provision of the services, we've priced it with the minds of all the Kenyans, and that is where to us, the public schools were the critical starting point, so that they can give us the kind of statistics and numbers that would help us in terms of developing a service that is sustainable to the long haul. Keeping in mind that this service that we are looking at, it's not only just geared towards looking at COVID alone, we're just looking at the health of every learner within any institution. At the moment, we've started with the secondary schools and the high schools, but we're also looking at possibilities of expanding it into the primary school arena. And we believe that as we continue with this idea, then there will be more investors and more people interested in providing the same sort of service. Because if you look at the magnitude of it, it's like you're going to be running a parallel health system, but which is institution-based within the various institutions. Thank you, James.
Okay, thank you very much for that. Maybe I'll go back to Etta. There has been a video going rounds when schools reopened and kids were sort of being fumigated, and somebody equated it to a cattle dip. Do you believe there are more innovative ways to deal with the whole COVID situation, even as schools reopen?
I think the reality, or I know the reality, is that the amount of fumes that we're currently consuming just in our living space with the sanitization and trying to make ourselves clean and healthy, it's also bordering on now also becoming unhealthy. So I believe there should be other systems of ensuring that the kids are being sanitized that are also not undignified. So I think the issue is also to do with what are the best procedures for making sure the students are staying sanitized, but are also not being sprayed down. And I think in terms of the videos, I think the uproar is mostly to do with that system of spraying is used for plants and cattle. So should it be used for the kids? I think as individuals, when you look at the port of Mombasa, the systems that are the port's ferry docks where you can actually walk through some space to be sanitized. I think there's other ways to ensure the safety without necessarily creating these scenarios.
Okay, thank you very much.
So if I may add on that comment Etta's made.
Proceed.
Yeah, I think it's also good to remind our attendees that it is actually the spraying. WHO has given a guideline guiding us to the efficacy of spraying human bodies in terms of sanitation. It's not effective. So in the first place, it should not be implemented. There are other means of sanitizations that are more effective. And if they have to be implemented, as Etta said, then they should be designed to be appropriately effective. So you consider the human beings, you could also consider the issue of pollution. And to add on what James had just commented on the Baringo case, I think we are not only, Baringo case, we are not only dealing with COVID, but we are also dealing with natural disasters. We are dealing with floods. And so even though DOM didn't have a chance here to share with us the proposed design interventions that we have, which our members and the larger public would be able to see once the report of the task force is published, we need to look at it in terms of the larger context of future-proofing schools. So that we have to design our schools for their context. The schools that are prone to flooding, the Budalangi, the Baringo cases, they need to be flood resilient. And there are a number of solutions that are already in place. You have floating schools. We have to ensure that this infrastructure that are being implemented in those places, very soon we'll be dealing with schools around the Rift Valley block. How do we prepare ourselves for the earthquake issues? We have the schools around the coastal zone, and with the climate change, we know that the levels, the sea rise is very high. Soon we'll be having that the schools that will have to be affected by the tidal variations. We need, as designers, engaging these people who are involved in the management of the infrastructure for different environments to begin thinking of how we really future-proof our living spaces, not only the learning environment. So that would be my context, to look at it in the bigger context beyond the health, the COVID scenario, but in terms of the realities we are dealing with in this current generation. Thank you very much.
Okay, thank you very much. So again, I'll have a twofold question, which will be directed jointly to our former president and Mr. Ngujiri. So maybe to our former president, somebody is asking, as far as students are concerned, have you guys sort of prepared a publication or some sort of awareness program for students once they resume school?
Yes, and that's what I was actually alluding to earlier, that beyond the physical hand washing and the physical elements that we're considering, there's also the mental health aspect that's very, very critical to children being reintegrated back sort of into physical learning. And someone termed it very interestingly, like grieving, the last 8 months. What it has been, and sort of giving the children a soft landing as they come back to school, as they're seeing their friends again. What does that look like for 1 week or 2 weeks, and dealing with what they've had to deal with in terms of a pandemic? Children have been as adults we've been affected, but but children have been affected as well. And if any of you have interacted with children, you will know, even at the height of quarantine, they had a lot of fears. And they're not privy to the same information that we are many times. So I remember my own children would be so scared if I wasn't home by 6:30 because they were scared of the police beating me up at 7. So they have gone through a lot of emotional turmoil, and we cannot assume we are where we were in March, even mentally, not ourselves as adults, but even more for children. So yes, we have a program just in terms of counseling and sort of reintegrating them back and letting them just be as they come back to what physical learning. But even moving forward, we're not going to learn how we were learning. So how are you managing that moving forward and reintegrating and finding a balance between technology and face-to-face learning? And what does that look like moving forward, what we're calling blended learning? I cannot say I have all the answers. This COVID has taught us one thing, is that you take one day at a time, even as educationists, where we were and how far we've come. I think it's almost a 15-year leap in terms of digital learning. Unfortunate for me, as I sit here, and in terms of a private sector player, is unfortunately even that leap has not been equitable. And we've, in terms of the public's education sphere, has not made the same leaps that private sector has. So there's a big disconnect. Even as we are coming out of COVID, there's a big disconnect and a bigger gap in terms of the haves and the have-nots, as it were, in terms of public sector. Even our teachers have learned so much over the last 8 months, but unfortunately, public sector may not. Very few have made the same digital leap as private sector. So yes, we have programs in, and we wish that across public and private, that there's a lot of thought into mental well-being of children, of teachers, and even of parents. You notice the resistance to reopening. That's almost, they need counseling as they're taking their children back. They need to be. I can imagine if you're a parent of a child in a boarding school, what it means to leave them and then later see them being sprayed, and what that does for you. So really mental health. Thank you, James.
Okay, thank you very much. So maybe I go to Mr. Ngunjiri, and while answering the question on availability of education material for students, somebody was also asking, a lot of focus has been placed on just the classrooms. We tend to forget about the dormitory facilities. We've seen a few schools. I recently saw Alliance and Kapsabet Boys making it deliberate for students to occupy, for a limited number of students per cubicle and stuff. Are there any efforts put in place to ensure the safety of students beyond the classroom?
Thanks, James. My experience in the various number of schools that we have visited is that, yes, they've provided the material in terms of communication, whereby what has happened is that We have schools trying to look at their health protocols that they were supposed to come up with and trying to simplify them, put them in age-appropriate kind of communication to the various learners. And I went to one school which was very interesting in how they were going to explain to the grade ones how to wash their hands, to keep their social distance and things like those ones. And it was quite interesting. The fact that the teachers also came a week before also helped in terms of them coming up with with committees that would help them in terms of coming up with that communication and providing the little sort of materials that would be required. Teachers also agreeing that the first week they might spend a bit of it in terms of, I know in one school where they have said, the first week we are not doing anything else, we're going to be handling the psychosocial support because this is what we need with our learners as they come in. And then they want to be a little bit more focused on the areas whereby they make the learners a bit more comfortable together with the teachers themselves, so that then it is easier for them to restart the school programs again. Then in terms of the other facilities in the dormitories, yes, there is also practice of social distance. But one of the greatest challenges that we have at the moment is that with the school reopening yesterday, it was a bit easy because it was just the only one class, which is the topmost class that they went for. But if, say, for example, in the next 14 days, the schools will be reopening, then it would be an extremely big challenge for the whole story about the distancing. And I don't know whether you've noticed, but I think the policy, especially in terms of the COVID guidelines, social distance is there, yes, and be talking about it, but it looks like it's now taking a third position rather than the first position. And what takes the first position now is the prevention of the individual themselves using the masks. Because at the end of it all, that might be the only sort of protection that the learners and the teachers together with the support staff will be having in terms of the fight of the COVID. So we've seen, yes, the dormitories, we have seen even the dining areas whereby they have expanded. I think the canteens at the start, they'll probably not be allowed to operate, but there are certain schools that have tried to create spaces whereby, yes, the learners can queue, pick whatever it is that they are picking from the canteen, and then if it's something to be consumed, it's consumed outside of the dormitories and things like those ones. So different schools have adopted different approaches in terms of the issues of the social distancing, of course, the hand washing and everything else in each and every point. And maybe a simple exercise like hand washing is turning out to be very challenging in terms of time. And even the bathrooms, in terms of the people, when they go in, you had only maybe you remember the whole story about the ratio of the students to the toilets and all those kind of things. So, and with the infrastructure not being possible to replicate, or as I've heard with the architects retrofitting, especially in certain areas, it becomes a bit of a challenge. And so that we remain to wait and see what happens when the other school is recalled. But at the moment as it is, yes, it is possible to achieve some of these social distancing aspects that we are looking at. And schools have tried to do the best that they can be able to do within the environments in which they are operating. Over to you, James.
Okay, thank you for that. Of course, now I'll turn over to Dom. A major component of sustainability is the whole issue of cost implication and economic dynamics to it. As the former president has mentioned, it will have significant implications as far as the economic plans are concerned. Do you believe that Kenya has the capacity to adopt the innovative measures, of course, just beyond the COVID-19 pandemic?
Yes, I mean, for example, the rainwater harvesting, and it's included in Kenya Building Code now, and you saw at the Waterbank School that is a driver. So for example, water harvesting, rainwater harvesting, is very much feasible and doable, and in fact incredibly straightforward. You just fit gutters to the roof, so that's easy. The wider discussion about sustainability, and I mentioned the words economy and ecology deliberately because they're often kind of lost in the debate. Don't forget that the Rio summit actually warned us of climate change 28 years ago, and you know, business chose to look the other way, and industries and so forth. I mean, in my world, actually decommissioning nuclear reactors, which is a program even in the UK is 25, 30 years behind schedule, is you know, that's a real health risk. And the cancer caused by plutonium and uranium and phenolic isocyanurate foams that we use to insulate our buildings. These are all toxic, harmful substances which we will have to stop, as architects, stop specifying. Foam mattresses, and one of the things that Kevin and Mazibali were very concerned about is surface spread of flame, and because in fact her contribution was focused directly on the fire at Moy Girls School, which left 8 children dead. Fire officers fire engineers will tell you that they don't die of incineration, they die of smoke inhalation from toxic plastic foams. Kenya hosted the plastics conference, was it the UN plastic conference last year? You know, fish are, you know, kind of 33–40% plastic. Coral reefs are dying and all the rest of it, species are being wiped out. So I think it's a matter of, the point about economy and ecology, I first heard it from Archbishop of Canterbury, Rowan Williams, who is not only a Greek scholar, a very wise man, because it's a balance. That's the thing. They come from the same word, home, eco, economy, ecology. That one is maintenance of your home budget, if you like, and the other is the extraction that you get, the yield you get from it. So you know, it's a big issue. Arguably, if China wants to continue to burn coal for its electrical generation, then we haven't got a chance. But perhaps, so, I mean, in terms of Kenya, as far as I can see, is the most ecological friendly country in the world, because there isn't any heating or cooling, there's a constant climate. The only reason to have air conditioning in the buildings in Nairobi is because of the noise and the air quality from the pollution from the cars, and of course those jams and the people sitting in those cars are breathing in toxic emissions which will deplete their respiratory resilience. So yes, COVID has opened a can of beans, let's say, not worms. The working from home thing, the reduction of congestion. You saw apparently there was that famous photograph from Nairobi looking at Mount Kenya, and suddenly when the skies cleared and the pollution went away, you could see the mountain that you hadn't seen for 40 years. So I mean, the shibboleth of the movement, if you like, let's call it a movement. We have Extinction Rebellion in various parts of the world, was reduce, reuse, recycle, which has gone out of fashion because the manufacturers, obviously, that doesn't work for them. They want you to consume, consume, consume. And that's it in a nutshell. But you know, that's why we in Team 3 have advocated or advised on forestry as the way out of this, because that has the double virtue of sucking up the carbon dioxide and providing a construction material that is solar powered, and it's a no-brainer.
Okay, thank you very much for that. Maybe just in terms of the economics of it, Carlos, one of our participants, quotes a World Bank modeling where it says that the amount of losses per child that we stand to lose as far as school closures are concerned revolved at around $4,500 that is per child. But I don't believe that that really necessitates the whole conversation about school reopening, even when people are not, or when facilities are not ready for accepting back students. So maybe to Nixon, do you believe that the solutions provided by the Ministry of Education, ranging from students reporting back early to school and having extended days in school, do you believe it's really worth the effort as far as school reopening is concerned?
Thank you. I think as the poll shows us, this is almost a 50-50, but 41, 59 kind of question. But from a personal perspective, in one sense, it's worth it because as Emma has said, you know, we have we can't keep our students anyway at home forever. And knowing very well that the COVID situation is actually something to manage. I just sent a post in response in the chat, on the chat page, what the WHO Africa Regional Director is saying. We need to reopen. As we are reopening the economy, we must reopening the education because education is a key component. But then we have to do this safely. So I think the way it is being implemented at the moment, that we having some learners coming back is okay. My only concern is our level of preparedness. One of the participants has made a comment about our kind of reaction attitude, that we have had a number of months to plan. And you could see this in terms of the policy statements from the Ministry of Education. Within 1 week, 2 weeks, we are prepared to know that we are not going to reopen. Then suddenly we have a pronouncement that students have to resume school within a week. Now, in a week, I could tell you as somebody who sits in a board of our high school, of actually 2 schools, the reality is that you have this pronouncement that is not really accompanied by tangible preparations to get those schools ready. So you have a ministry saying the schools should reopen in a week, that is on Monday this week, and the schools have not received their disbursement as at this Monday of this week. So you expect the principals to prepare the learning environment, get the supplies for the sanitation, you know, those sanitizers, get these things all in place without money. The teachers, they were called back 2 weeks ago, but they're not really fully prepared. So why I say the answer is yes and no is that it is yes, because we need the schools to reopen. First, reopening is okay, but it needs to be done safely through proper planning and engaging all stakeholders. It can't be something that you wake up over one day in your household. Even you can't prepare your kids and tell your kids today, you know, tomorrow we are going to school. Then you wake up tomorrow in the morning, the kids have woken up earlier, they are anticipating, very excited. Then you tell them, oh no, sorry, something has come up, just wait, mommy, we'll go to school the following day or next week. Then tomorrow, when you come back from the work in the evening, you tell them, you know what happens? We have to go to school tomorrow. Even psychologically, that is really not preparing our students. So my answer would be simply, in terms of, at the moment, our preparedness is not adequate. We don't have even very clear guidelines to the schools. What has been posted nationally, we have the basic education guidelines. As at Friday last week, I could tell you the schools there are partly involved in is an extra county school. So if you're talking about information relay, you should expect that the extra county school should be receiving the information much quicker than the small, you know, district school, the ones that in the rural area. But as of Friday last week, even the school heads of such big public schools didn't have very clear guidelines on how to implement those basic guidelines that have been given by the ministry. So I really don't want to blame the government here or pointing fingers, but I'm just presenting the reality on the ground, that we are not adequately prepared to even open our schools in a phased manner as is already presented. But we need to reopen the school. We need to plan, we need to engage the stakeholders, we need to prepare our students, and we need to prepare the schools to be able to receive our students to learn in shifts, to learn, you know, in whichever parts that are realistic for their context, because also schools are different, both private, public school in different settings, both rural, city, different locations, they have different realities. So we need to plan for that. Thank you, James.
Okay, thank you too. Speaking of preparedness, the former president says we had 8 months. We never really, they say vitu kwa ground is different. So maybe in terms of preparedness and the guidelines issued by the Education Ministry, Mr. Ngujiri, something notable and quite disturbing is that it fails to mention anything to do with isolation centers or management facilities for COVID patients within schools. This was a major emphasis at the beginning of the COVID-19 pandemic. Why do we seem to forget about the need for an isolation facility within a school environment?
Thanks, James. And I think maybe I can look at the guidelines that we had mentioned, that I had mentioned earlier on. But specifically to the question that you have asked, the guideline has it, that you're supposed to provide, okay, maybe the wording could be the one that doesn't sound like it's an isolation center, but the way the guideline is worded is that you're supposed to provide and manage a school dispensary or sanatorium, and that including a management of home-based care for infected students where appropriate. That's the way the guideline sort of puts it. I can't claim to have quoted it word for word. And so this home-based care in quotes is what is the isolation center and or the isolation facility that you're supposed to be having. And I think most of the schools, what I have seen is that they've, for now, they have tried to come up with temporal sort of solutions, which are classrooms, where they've tried to provide an isolation center, which is a classroom, hoping that within the shortest time possible, in the event that the other students are coming, that they'll be able to put in a facility that can be used as an isolation. So that one is that one had been given, but going back to what Nixon also mentioned, I think the greatest challenge that we have is that at times I feel it's like we are waiting for the government to do everything, and if the government is going to do everything, then nothing will be done. That's my position. And, I understand. Yes, we pay taxes, and so we have the rights to demand the services and everything else that we are supposed to be provided for. But now speaking maybe as a finance person and looking at how much does it goes into the health and budget, it's about maybe 60 to 70 billion. And this is supposed to provide for you the workers, it's supposed to provide you the infrastructure, it's supposed to provide you for everything. So the question begs, or one would ask is, how much can that be able to do? I guess that can only go into the payment of salaries of the health workers, and that will be the end of it. So I think then there's need to create a different sort of mindset. And if you look at the policy, and I believe that is what they were trying to achieve when they were saying that the community should be involved in the mobilization of the resources, I think they were trying to look at how else can we be able to look at this situation and provide the service that is required. Because at the end of it all, healthcare financing, it doesn't matter, even look at the United States, is still a big challenge, even to the biggest economy in the world. So for Kenya, we probably, even when you look at the US, which is like 15 size, in terms of economies, it's like 15 times the whole of Africa. And Kenya, we are just a dot when we come to compare those two kind of environments. So I think what we may need to look at is to discuss how can we be able to achieve, because the how is what is not there. The guideline has been provided. What seems to be lacking is when you say develop and document infectious control protocols, for example, what is really expected. And on one hand, it might be difficult for us to expect the government to tell us what exactly is expected. And what I see this happening is that that should be pushed down to the various boards of management. and as I can't remember who mentioned it, one of the people who are participating in it, they said that we need to have all the professionals included. If we have all the professionals included, and say, for example, in a certain board of management, there's a health professional, maybe a doctor or somebody like that, then they're able to tell them, okay, fine, infection control protocols look like this. And so this is what is expected of us. When there is an architect, they'll be able to tell us, together with the doctor, this is how the isolation facility is supposed to look like. You can't use this kind of material, you'll use the other different kind of material. So I think it is time even for the professionals to get out there and try and do something. Maybe as part of giving back to the society, rather than only go and donate maybe some of the things that we normally see, let me not mention them. I think it might be helpful for us to also consider donation of our own expertise, donation of our own experiences, and to the various schools. And I believe all of us, to be where we are, we passed through a school. So why can't I go back to the high school I went to? Why can't I go back to the primary school I went to and help them in the house? Because in terms of the guidelines, the government has tried to do as much as it can be done, or the task force that was given the job, they've done as much as they can be, that they can be able to do. But then the how, it's left to the professionals who can be able to decipher this and be able to help the institutions in terms of its implementation. That would be my view. Thank you, James.
Okay, thank you very much, Mr. Ngujiri. And there's another question, maybe I'll direct it to Eta, because it really concerns the issue of innovative designs. Do you think the appropriate procedures to handle people with disabilities as far as COVID-19 is concerned? And while at it, did the task force really appreciate the role of PWDs in the society as far as their proposals are also concerned?
I think in general, as a society, the buildings that we designed are not conducive to disabled access before or after COVID. I'll give an example of something I was discussing today, which is my university, my department, the Department of Architecture, cannot actually train a disabled architect because we are on the 4th or 5th floor. That's where our studios are, which is very against what we're trying to teach the architects of the next generation. So I think in terms of learning institutions and spaces, there's a whole amount of work that needs to be done to make it inclusive for all. The task force looked at it in a small way, but we were focusing mostly on the health aspect, not necessarily the accessibility side of it. But the retrofits that need to be done just for inclusivity are part of the retrofits that need to be done in almost all schools before and after COVID, and especially during this time where we are accommodating many more students in much bigger spaces due to social distancing. So just the same way that we can embrace CBC curriculum in the way that we redesign and build back better, it could be part of the way that we redesign spaces to be inclusive and accessible to all. And as I mentioned earlier, the problem or the opportunity with education is that we have to make education accessible for all. Inclusivity with the numbers that we're dealing with during COVID and with social distancing is not the same as how we do social distancing in an airplane or in a supermarket. For schools, everyone needs to be able to learn and participate in what the teacher is saying, be able to hear the teacher. So how can we bring education right close to the person? How can we use more one-on-one learning methods? And as we're looking, as we can see in the university education system, because the University of Nairobi is now teaching virtually, you almost have to change the way that you teach, change the way that you examine, and also change the way that students have access to information. A lot of open book learning, a lot of assignments, a lot of self-independent learning, as well as questions that the students have to come up in small groups. So it's almost, as Emma mentioned, a wake-up call to sort of examine the way we teach and make sure that it's as accessible to all people, as well as that it is fair during this COVID time, that no class, no student, especially depending on where their schools are, and I've seen a question from Carlos regarding the popular schools, where many parents send their schools to the good schools and they get most of the infrastructure. So it's a lot to do with inclusivity. And as people have mentioned, I think 59% said they're not comfortable with students going back to school. And I think the sort of feeling is that it's not fair for many people, because many people don't have the ability to participate in this learning during this time. So as has just been mentioned, we were given 1 week. So this preparation is yes, it's been 8 months, but to actually the schools opening, it was 1 week of preparations. So I think the thought and care needs to be given to not just the physical spaces that need to change, but also the fact that the social and mental preparation it takes for children who at some point, at some level, they don't actually know what's going on. How do they now begin to learn and to start studying and to get back into their books, especially at such a season that they're in now? And how can architecture and design enhance that? Can we look at timeshare, for example? Look at ways to ensure that the students who are in school are still able to interact and not overcrowd. So I think there's a lot to be done. And even those schools are open now, there are things that can be done now to ensure that students who are going to school have that kind of experience and environment that is conducive and inclusive as possible. Thanks you.
Okay, thank you. Talking of having inclusive and conducive environments, maybe I'll just go back to Emma on the issue of retrofitting and use of existing infrastructure. The recent school reopening was based on rumors. As it is now, there's another element or quote unquote rumor that the rest of the school-going children will be going back to school within the October month. Do you think your facilities will be able to accommodate all the students while adhering to the MOH guidelines as far as social distancing is concerned?
Thanks, James. And I think the one thing that we've all learned from the pandemic is the value of communication. Communicating clearly, communicating vulnerably when you don't know the answer. I think all our leaders could do with a lesson in that, in terms of just actually saying, I don't have the answer, but I have best intentions, rather than the ambush and the ping-ponging that we have been exposed to. And in a time of crisis, I think it's not the kind of communication that you need. I can tell you rumors, probably now I'm hardened, but in July, 1 minute, like Nixon had said, 1 minute it's this, 1 minute it's the other thing. And you can imagine as an adult, it caused a lot of turmoil, even just in terms of planning. 1 minute we're opening in September, the next minute it was January with loss of academic year. We've come back to reopening in October. Nobody has even acknowledged that we initially communicated January and we are sorry, and this is the reason. And I think in all this is also a value of PR and managing people. And back to mental well-being, even of children. You can imagine all those children who, especially in doing the exam this year, what they've gone through. Now they're back to readjusting mentally to doing an exam in March. I almost now forget what your question was, but you were asking whether we have capacity. And of course, capacity, we did not design for a COVID situation in terms of social distancing. We were using other parameters which are not the COVID parameters. And that takes a lot of resourcing in times like this. So the waking up and saying 1 week we are all reopening, there's a lot of resourcing and planning that is required for that to make it happen. And I think Nixon actually, he was reading my mind in terms of just the ping pong, even financially in terms of resourcing and mentally, and getting people back. People were put on unpaid leave, getting them back to come back and pick up, pick up from where they were is really difficult. So I think most schools, private, will struggle. And I feel for the public schools even more, because we, as Nixon actually mentioned in the chat, you find private sector is very agile. We have learned to survive. You can see it in whether not only education, but all the other sectors, we have found a way of thriving. We have a certain level of agility in terms of quick decision making. I feel for the public schools, because they're in a worse situation, and then they're under-resourced to make matters worse. So here you have a head teacher who's having to think about accommodating all these people with no resourcing. So it'll take a lot of agility, and I'm sure there's a lot of solutions in terms of shifts and the like, even as we plan, because it does take a lot of resources to build for a COVID-proof school, and therefore we might have to make do what the resources we have. Just seeing that we've gone through a very economically trying time as an education sector and even as a country as a whole. So agility and flexibility and an open mind will if there's anything I have learned, it's just taking one day at a time and planning for it. Yeah, and hoping whoever's in charge doesn't wake up tomorrow and say something different and throw you back to the drawing board, as it were, literally. Thank you.
Okay, coming from the director of Kyoto School, I feel sorry for public schools, but we hope and pray that all will be well. So maybe in the interest of time, I'd invite our panelists to just give us a parting shot as we wind up our conversation. Maybe I'll invite Nixon.
Yeah. Thank you very much, James, and thank you all panelists. And I really send out thanks to all the members of the AAK who volunteered their time and intellectual, knowledge to contribute to the task force. It's a brilliant work that is under editing, and I really look forward to the report that is coming out. And thanks to all the participants that have also joined. My really rallying call would be, I think the COVID situation has given us a challenge as an association, as professionals in the country, that we cannot just sit back and lament. Like, we are really saying the shortcoming of the government, we not just to point out, but we really have to come out to provide solutions. So we need to reach out more proactively to these policymakers where they are having oversight. We need to reach out to them proactively. So our real prayer as AAK and my wish would be that this work that we are taking on, we should carry it forward to be able to disseminate this information to the larger membership. The design interventions, very interesting schemes that will be coming in the in the report. This should be shared by the professionals so that in their practice, including those who have participated in government, we don't need to have the template of the same design for all schools in all setups for the past 3 centuries carrying into the next century post-COVID. So we need to disseminate this more proactively, and I think the association can help. Let's use our platforms to be able to disseminate this information so that more professionals shape the built environment. But from a policy perspective, I really look forward to more engaging with the Governing Council and the Executive Committee of AAK to really lobby within the government. We need to have the built environment professionals be considered in every issues dealing with built environment. Just the way they think about lawyers before they talk about policies and foreign, they need to remember whether they're talking about agriculture, they're talking education, healthcare, they should always remember that they are professionals who have expertise that should be able to be brought on board to engage in this. And lastly, I call upon you, members and all of us, that let's demonstrate the possibilities. And I would be challenging the association, which I'm part of, the leadership, that lets us bring out model projects. Let's take 1 or 2 examples outside there, mobilize our membership, mobilize stakeholders, and demonstrate the possibilities to address some of those gaps we are crying out for the public schools and also for private schools in largely the low-income settlements that are not able to actually meet these stringent requirements. Overall, I say thank you very much, and I look forward to future engagement. Thank you.
Okay, thank you very much. Maybe Etta, your parting shot.
For me, again, is to say thank you for the task force. It's been an engaging experience, but also I think we are also in the situation where we are adults designing for children. So we have to take ourselves down to the people who are going to be using these spaces and using these interventions. And many times architects were designing spaces for other users. And sometimes, in most cases, these other users are adults. But I think we need to think, how do kids interact? How do kids move around? And Emma can sort of testify at a kindergarten level. I mean, COVID is, once you see your friend, COVID disappears. So I think let's see this not only as a sort of a struggle, but also as an opportunity to change the way that the spaces the kids are using are designed, not only for them to experience teaching and learning in a different way, but also for them to sort of lose the fear of what COVID has done, lose the trauma that has happened in the last 8 months. Let them know that the future is not masks and getting sprayed down like a cat, like a cow, but instead it is a new way of teaching, a new way of learning, a new way of using spaces more widely and more openly. So those are my two parting shots. That first, as we look at these interventions at policy level, as at the design table, think of the children using the space. And second is that it's an opportunity to change the way that we teach and change the way the children experience learning in these spaces. Thank you.
Okay, thank you very much. I'll invite Dom Cox for his parting shot.
Yes, thank you, James. Well, I echo the Nixon's call that architecture should be responsive to its age and its cultural values. So quite right, arguably, if it isn't responsive to those, it isn't actually architecture. And so he's right that we're in the 21st century. And so what modernity looks like now is changing. That's why I raised the Form 3 set books in English and Swahili. These are introspective and address an equality agenda, what someone else has called inclusivity. So that architecture is part and parcel of that cultural intention, and it's manifest in architecture, in literature, in arts, and arguably in politics. So that's what architecture ought to be doing. It's part of the cultural life of any society. Regarding the pandemic specifically, I don't think we should lose track of tuberculosis and cholera and others, but particularly those. I mean, there was plague, I think, in Madagascar a while back. So let's not lose track of public health in general, because arguably COVID, in terms of children, I mean, in the UK, the average age of mortality is 82 years old. Children are not actually in high risk. But one of the problems that has been raised in Liverpool, which the city has gone into second phase or second peak, as its second wave total lockdown, is that there's got 500 teachers off sick. So, you know, actually, that's one of the risks here, is that the children may turn up to school, but there may be just too many teachers off. Whether it's because they are broke, because they were on unpaid leave, as Emma has pointed out. And again, Emma's point about the private and the government schools. And the fees for the international school in Nairobi are $36,000 a year. Braeburn is, I think, $10,000 a year. And a government school is about $600 a year. So the disparity of money available to the head teacher is huge. And this inequality is a theme of our globalized world. And arguably it is poverty that is the real killer. Thanks.
Okay, thank you very much. I'll invite Mr. James to give us his parting shot.
Thanks, James. I think when I look at the entire environment and what has happened in this year of 2020, my parting shot would be this. First, we are going to be faced by risks all our lifetime. And I think that is important for us to keep in our minds. And here I would like to define risk as any hindrance that will make me not achieve what I set out to achieve. If I'm on a journey, what will make me not complete that journey? If I'm doing a building, what will make me not be able to deliver that building to whoever the client is? And so if I'm going to be faced by this item called risk all my life, then I think what I need to be aware of or alert about is how I deal with it. Because how I deal with it will determine whether I continue or I'm going to be extinct, either in business or as an individual or as a society. And COVID has taught us, or has taught us, as the entire world. Thank you, James.
Okay, thank you. And finally, I'll invite our former president.
Thank you. And I think everybody has summed up everything very, very well. But the one thing that COVID has taught us is that we're all joined together as humanity, and whether it's the haves or have-nots, COVID has shown us that for all of us to prosper, even the least quote unquote among us must prosper, and we're all joined at the hip. So I think if there's anything, we must stop investing too much in highways and railways and start investing in housing and education and health, the basic needs. And I hope in some way COVID will, at a risk of sounding like a socialist, but COVID will teach us that as government, as leaders. And just want to leave us all with a quote that we are all at certain times in our lives will find ourselves broken. This is not the first time, and this won't be the last time. But truth's strength is found in picking up the pieces and putting them together and facing another day. So, aluta continua, we live to fight another day. Thank you.
Thank you. Aluta continua it is. Also from me, I'd wish to thank our participants. As the chair of the task force on school reopening post-COVID, we hope and promise to share the document as soon as it is ready. So I'll invite over our communications manager to give us a vote of thanks and bring the session to an end.
Okay, thank you so much, James. I take this opportunity to thank everyone who has been involved in this webinar. Thank you so much. I'd like to thank our panelists for a very interesting discussion. Thank you, James Ngunjiri, Managing Director of Heri Health Care Consulting. Special thanks to our immediate past president, Architect Emma Miloyo, who is also the Director of Kyoto School and Director at Design Source. Thank you, Dom Cox, who is a BIM expert. Thank you, Architect Nixon Otieno, who is our Honorary Secretary, AAK chapter. I'd also like to thank Eta Madete, who is an architectural designer and tutorial fellow at the University of Nairobi. I'd also like to thank our moderator of the day, James Odongo, who is an urban planner and the acting research and advocacy manager at AAK. Thank you all so much. I take this opportunity also to thank the AAK president, Architect Muguri Njendu, for also making this possible and just ensuring that this comes to pass. I'd also like to thank all our attendees. This will not have been possible without you. And we continue to have these discussions. And yeah, we'll invite you also for more in future. Thank you all so much. And God bless.
Thank you. Bye-bye.
Bye, thank you. Thank you.
Thank you so much.
Thank you.
Let's meet again soon.
Okay.